I often work with patients as well as their families because cancer is very much of a family disease. It not only affects the patient, but it affects their loved ones as well. The biggest challenge that newly diagnosed patients face is that dealing with survival. Unfortunately, when many people are diagnosed with cancer, their first thought is this is a death sentence. And the fact is that that's no longer true. The survival rates have gone way up in most forms of cancer. So one of the first challenges is to instill hope in the cancer patient.
Basically, I was unable to cope with the psychological aspects during my physical treatment. I think there was a slow decline in my ability to handle it. I wouldn't acknowledge it, or I couldn't acknowledge it until the time was right, until that moment.
When I see a patient for the first time, I'm aware of the fact that they're often reluctant to accept counseling because they don't know much about it. And I explain to them, first of all, that I'm a cancer survivor. So I understand the stress that's associated with cancer. Depression and anxiety are often associated with having cancer. There are often worries about survival and a number of issues which are amenable to support in getting counseling.
My decision to finally agree to see Dr. Grebstein was the result of my giving up the battle, that part of the battle which was my psychological growth, my psychological healing that I needed to have take place. The physical treatment, the physical healing process, I felt was all I needed to do. When that drew to a close, I realized that I needed to do more. I couldn't stop. I needed continued help.
Patients often wonder how they can benefit from getting counseling, and I often outline these to them. First, primarily, there's support, to have someone that you can talk to. There are a number of fears that patients have about survival. If they're in remission, will their cancer come back? There are specific techniques that we use, such as relaxation therapy and visualization and other forms of therapy that are specifically designed to deal with the stress associated not only with cancer, but with other physical disabilities.
The treatment that I received from Dr. Grebstein and his assistants continues from the moment we first met, and in fact, in a lot of ways grows, because the application of the lessons that I learned here apply to a lot more than what came from the cancer.